Thank you very much for your contribution. After listening to all of these comorbidities, my approach will probably be an integrative presentation. My aim is to answer two questions. How are we to look at the difficulties and resistances in treatment, and what are the solution suggestions in the clinical setting for treatment resistance and difficulties? What are the treatment difficulties? There is a glass jar. You see stress, lack of control, craving, withdrawal. These are fundamental aspects of dependency. Is there another laser pointer? This seems to be not working. Difficulties in treatment, really stress, craving, lack of control, and withdrawal causes relapse. And this in turn bounces treatment and makes it difficult for the attempts at prevention to work. Which information should guide us in approaching treatment difficulties? Stress sensitivity, the fundamental questions. I would like you to listen to the theoretical aspect in this manner. This information might seem to be theoretical, but actually this information is information to be shared with the patient and the patient's family. This information should be ready at hand for us to be able to share it with the families and the patients. We know that stress is very important for the patients. We know that increased stress situation causes substance use in the patient. Stress, the subjective and behavioral effects of the substances, do they change under stress? Yes. Stimulating effects of amphetamine and alcohol decrease under stress. Stress in any case increases. Does the stress in any situation cause an increase in substance use? No. Those patients with high hostility scores or those patients with drinking episodes, stress has been shown to increase consumption. Then stress sensitivity, in which patients stress sensitivity is important? Of course, all of our patients would have an easy answer, but this is not true. Stress sensitivity is especially important for our patients with more than one diagnosis, with those patients whose ego protection is inadequate, who are narcissistic, obsessive, hostile, which have certain personality traits. Patients with multiple diagnoses are very common, and the treatment is very difficult. I would like to present you a case. This is a 23-year-old female patient, very severe functionality loss. We have a diagnostic formulation. All of these diagnoses, Axis 1, Axis 2 diagnosis need to be considered in differential diagnosis in trying to decide the optimal treatment. Alcohol dependency, substance abuse, eating disorder, bipolar affective disorder, attention deficit hyperactivity disorder, borderline personality disorder. All of these disorders, diagnoses, need to be taken into consideration. This is a publication from 2009. They had 150 adolescents. 1/3 were depressed at the beginning. 1/3 had depression in their parents, and 1/3 did not have any depression. And they followed these adolescents for 5 years. This is a wonderful follow-up study. They showed that depressive disorder, there is an indirect relationship between depressive disorder and substance use disorder. HPA, access activity, and stressful experiences seem to be the major moderators in determining the relationship between the two. The most important result of the study is as follows. HPA, if it is low at the beginning, then it is low. If it's high in the beginning, then it is high. But stressful life event in the past 3 months was related with substance use, increase in substance use. In both groups, whether HPA is high or low, stressful events were shown to increase the substance use. Conditioned withdrawal, this is the mechanism of action of acamprosate. You see here withdrawal and conditioned withdrawal. This is Wickler's behavioral pharmacology of dependency was his area of study. He says all of them have pharmacological effect in the central nervous system, and they also cause reverse effects to overcome these effects. We know that some patients, sometimes we see patients who are using alcohol conveying withdrawal symptoms. We have a wrong view. Sometimes we think that the withdrawal symptoms only occur when there is a interruption of use. No, this is not true. Affective mood, affective situation, mood might be related with substance craving and substance use. With conditioned stimulus, the patient goes into conditioned withdrawal and thus show the reactions. Kantsian in 1985 brought up the idea of self-medication. Affective emotional situations which are very intense and uncontrolled. This is also called affective flooding, where the person is not able to cope, plus the deficiency might cause automatic behaviors. The patient is trapped in conditioned situations. Triggers, emotional triggers, usually are not really recognized by the patient, or emotional triggers might not be able to conveyed by the patient. The trigger plus the substance effect might make it difficult for the patient to remember the emotional trigger or insult. Lack of control is another issue. Lack of control can be explained through conditioned withdrawal. Substance intake, euphoria, smell, causes reverse effects, withdrawal, conditioned withdrawal, which results in substance craving, which causes in substance intake. Let me tell you, what I show you here is what I show my patients as well, because the patients need to know these things. What are the clinical solutions that we can advise in overcoming treatment difficulties? This glass jar, we need the patient to realize that there is a glass jar. There are hundreds of conditioned stimuli in the patient's life, which the patient might not be realizing, which doctor might not be realizing, and we have to go through this closed net and realize these stimulus. How are we to do this? We need to give enough time for the patients to understand the concepts in the right time, with the right communication methods, in the right manner, both for the patient and for the patient's family. We should use multidisciplinary treatment modalities. 6 aspects of successful treatment is frames. Menu is something I want to underline. One of the main courses in the menu is to create a front for the conditioned stimuli. I want to talk about network therapy. I advise you to read about network therapy. Galanter has read a lot about this network therapy. His recent publication is from 2008. Johnson starts with family interventions in the 1980s. Johnson's family intervention is very confrontational. Johnson brings the family together and tries to put the patient in line. They threaten the patient. Of course, Galanter's is very subtle in comparison to Johnson's. The idea is to create a network where the patient and when the doctor is involved. Average number is 2.3. The network can consist of wife, friend, mother, father, sister, brother. Psychoeducation is crucial. Treatment, medical treatment. They form a task force for the patient in order to ensure the abstinence of the patient, to take the patient out of the glass jar. The idea is to form a network, a task force, to help the patient in getting out of the glass jar. I want to give you a case presentation. This is Hussein Bey, 46 years old, second marriage, marital problems. In 2007, there are periods of abstinence. His stress sensitivity is very high. He has scratches, he has insomnia, he is hypertensive, he has a genetic tendency, he has very obsessive personality traits. He creates lists, schemes. This is his hypertension records. When he brought this to us, of course, it made us very easy. This is his treatment diary. It's an extract from his treatment diary. With this patient, we did neurobiology education, drug treatment, drug education. He says, in the last 15 days, there was nothing bad going on in my life. I don't know what I would have done if there was something bad in my life. There's an asterisk. Usually I have a drinking crave between 18 and 19 hours. It passes after dinner. Sometimes I miss my friends and their chat, and I miss chatting with my friends over the drinking table. Usually, patients' families tend to be taken away from their position within the network. They are no longer accusatory, accusing the patient. That's one of the functions of the network. In some of our patients, in some of our bipolar patients, life scales pointing out alcohol episodes and mood episodes very important. This is a This is a table for the patient. You see the panic attacks, distress. Such tables, talking over such tables, it is like putting the patient under a microscope. Therefore, studying these tables, how the slip happens, it's very nice to be able to do this. Drug and neurobiology education, there are many things we can do with the drugs. With the menu, we are very strong. In the past, we didn't have any drugs, but now we have many drugs at hand. And we can use anticonvulsants, we can use anti-craving drugs, naltrexone and acamprosate. Drug use and drug education. This is the same patient. Anti-craving, Etilex, Antabus. I had made this combination. The patient said he wrote no side effects involved to relieve himself. You should talk with with the patient, you should agree with the patient. I talk about this mouse to my patients. I talk about these mice to my patients, with my patients. If they do not like animals, then I talk about alcohol and dysphoria and the relationship between alcohol and dysphoria, so that they can understand the relationship between their dysphoria and alcohol use. The most important thing is to include all the members of the network into the treatment. Patients' morale is very fragile. The family members can become very good co-therapists. Antabus with evidence-based medicine. Evidence was 1B, but with meta-analysis, the evidence was higher. It was 1A. It's not family therapy. Galanter said network therapy is not family therapy. Because in family therapy, you need to resolve the dynamics to reach a resolution. But with network therapy, we do not have the task of working with the family members as if they are patients. Behavior-focused, abstinence-focused, educational and directive therapist is the key in network therapy. The idea is to have a task force which work with the patient with good morale. The patient is at risk for stress and conditioned stimuli during the process of dependency treatment. If you can form a network, then it is easier to treat the patients. With the formation of network, all those therapies that work hand in hand increase the treatment success. Thank you. This is, Yiğit Özgür's caricature. The guy is asking for a new point of view. He's saying, what point? He says, point of view. And I think it's